while they're doing this, I can already start introducing the first speaker. So I'm going to pronounce your name as Jules Dupuy, but then I wasn't sure whether you're American or French. Or... Jules Dupuy is currently visiting pre-doctoral scholar at the Leonard Davis School of Gerontology at USC, so you know where that is. So you have the floor.
So thank you very much for this introduction. I'm very happy to be here today. So I'm going to present an empirical application based on the UAS HRS database on the individual risk perception and long-term care insurance. So basically the main research questions are the following. So we are looking at how does individual risk perception drive the demand for long-term care insurance, and we'll briefly look at the role of time preferences as well. So I'm going to briefly frame the topic and present the main variables we use, and show some quick statistics and results we have for now in this explanatory work. So just to frame a little bit, what we call long-term care involves like a wide range of services designed to meet person's health, and especially we look at the care which helped people live as independently as safely as possible. Sorry, and so it includes the informal care from home, as well as the nursing homes facilities, and we can have also broader definitions, which includes basically all the care which help people to live independently. And in the US, it represents 1.6% of the GDP, which is on the OECD average, but which is not like which is not a big amount compared to what is the US global spending in health. And so the long-term care becomes is already a hot topic in the US, because more than 46 million of adults are nowadays over 65, and this figure will be like the double in 2050. So the demand for long-term care is expected and supposed to increase dramatically, but at the same time, it remains poorly integrated in the public systems, and especially in the US. So people might face potential catastrophic out of pocket expenses. So I have some numbers about the lifetime risk of using. So it includes all the use ranging from a few days to a few years or several years. But this risk is about 50% in the US. And 5% of Americans will spend more than $47,000 for the stays in in their whole life. So that's a big number. And paradoxically, only about 1/5 of the people over age of 65 purchase long-term care insurance. So the market is incredibly small compared to the risk. So there are many papers on the supply side factors and demand side factors overall. I'm going to focus on the literature about risk perception, which is surprisingly not that developed. So what we know for now about that is that the limited information about financial risks lowers the demand for long-term care insurance. We also have one paper on the role of misperceptions, so the difference between the objective risk and what people think the risk is, which is very limited in decreasing the demand for long-term care insurance. And we have some evidence of the impact of risk perception, but in a very crude way, because it's just a dichotomous variable equal to 1 if individuals think their risk is lower than 50%. So that's crude measure of the risk perception. And we also know that impatience decreases the demand for long-term care insurance. So this paper tried to contribute to the literature by broadening the understanding of the role of how people perceive their risk on the demand for this specific insurance. So the hypothesis is that the perceived risk is a more important determinant of the purchase of an insurance than the objective risk. So more specifically, we're going to use a continuous measure of risk, so an assessed probability of a person's risk. And we're going to try by this continuous measure to look at the potential threshold effects, which was not possible with the dichotomous variable. So I'm going to use the Understanding America Study Health and Retirement project, which has been presented this morning. So I will be quick on that. So it's about 8,000 individuals in this 4 waves survey, and so individuals can respondents are interviewed every 2 years, but can take the survey at different time. So this is the specificity of this panel. And I'm going to focus on the following variables. So first, the long-term care insurance, which specifically covers nursing home because it's known as being the most important spendings overall in the long-term care in general. And my main variable will be the assessed percent chance to move to a nursing home in the next 5 years. And I also look at the time preferences in specifically in planning the saving and spending. So I'm going to develop a little bit after that. And so I'm looking at the individuals age more than 58 years old, because those are the individuals which are asked this specific question about assessed probability of moving to a nursing home. So I have some crude socio-demographic statistics comparing the long-term care insurance and the non-long-term care insurance samples. So basically, in this table, we see that age seems to be related to the purchase of a long-term care insurance, but we do not see many differences in the both marital status and race. However, in this following table on the working characteristics, that's not that surprising, but still we find that, just by comparing two samples, we see that the education, the more people are educated, the more they are likely to have a long-term care insurance. And it works as well for the working status. So the retired people are more as well likely to have a long-term care insurance, and so we have the feeling that those variables could be associated with the purchase of a long-term care insurance. And we also have, so that's the table with the variables I'm focusing specifically on. So the first variable is the percent chance to move in nursing home, and we see a significant difference both in both samples, in both subsamples. Sorry. So it seems that the more the assessed probability is high, the more people tend to purchase a long-term care insurance. We have just to show we have a surprising figure with the disability variable, because we see that disabled individuals are less associated with the long-term care insurance, and it mostly comes from, I guess, a substitution effect between some specific disability plans and the long-term care insurance plans. So disabled people can fall into other specific plans and not the long-term care insurance plan. So that was just to mention it. And so I'm going to present briefly the explanatory results I have for now. So we run 3 models. So we run a pooled model just to have a benchmark of what is done in a cross-sectional way, and most importantly, so that's very small. But we run especially both time and individual fixed effect model with an unbalanced panel. We also did it with a balanced panel, but it is more difficult because the sample size decreases sharply, and so we have a very small significance and significant power in the results. But basically what we show, so that's the sum up of the previous table. So the panel structure of the data allows to estimate more accurately the effect of risk perception on long-term care insurance. And especially by using this continuous measure of risk and not a dichotomous one, we can see that each additional percentage point of risk perception increases the likelihood to purchase a long-term care insurance by 0.038 point of percentage. So just to give you an example, I did it with 75%. I don't know why, but I could have done with a different figure. But so an asset probability to enter a nursing home of 75% increases the likelihood to purchase a long-term care insurance by 3 percentage point. Okay, so we just showed a nonlinear effect by specifying some categories on the risk perception in the previous table. But so basically, that's the results we have for now, and I'm willing to answer any question if it was brief and quick to present that.
Thank you.